The Admiral demanded the best surgeon available. He didn't expect the answer to be the woman stocking gloves in a forgotten hallway. And here's the question that won't let go. What do you do when the life you ran from comes back wearing a uniform and a deadline? It's 3:41 a.m. in Wilmington, North Carolina. Fluorescent lights buzz over scuffed linoleum. Bleach hangs in the air. Emma Keller counts suture packs with hands that don't shake while down the hall, men with clean badges and easy confidence laugh about how small she must be. Outside, the ocean wind rattles the glass like a warning. Stay to the end and you'll see how real trauma is managed when systems collapse and seconds decide who breathes. If you're watching from a hospital, a base, or a quiet room at home, hit like comment where you're watching from and don't look away. Emma does not look away. She keeps her eyes forward because in places like this, looking away is how mistakes slip in. At 3:41 a.m., Cape Haven Medical Center feels less like a hospital and more like an engine room that never powers down. Fluorescent lights vibrate above scuffed linoleum. The air tastes like bleach and old coffee and the cardboard dust that clings to every supply box. In the closet behind the emergency department, Emma Keller stands alone with a tablet that lags between taps. The screen is scratched and dull, like it has been dropped 100 times and forgiven every time. She counts suture packs in a steady rhythm. 12, 24, 36. She stacks them by size and type logs, each lot number without hesitation, and slides the next box forward like the motion is a drill. Count, stack, log. Her hands do not shake. They have not shaken in years, not even when they should have. There is a scar on the inside of her left wrist, pale against the skin, half hidden by the cuff of her scrub top. The overhead light carves shadows under her eyes, making her look older than 35. Sleep avoids her the way smoke avoids an open hatch. She can feel it sometimes, the fatigue pressing at the edges, but she holds it back the way she holds everything back. A pen clips to her pocket, black titanium worn smooth at the edges. The kind of pen that does not belong in a supply closet. The kind of pen built to write when the world is wet upside down on fire. The clip flashes when she shifts just a sliver of light, then it disappears again. From down the hall, voices drift through thin walls, casual and careless. A break room door swings, hinges squeaking like a tired complaint. Dr. Brent Holloway speaks first voice, confident in the way of men who have never wondered if they belong. She is still doing stock counts, he says, amused. 6 months in, and she is basically our supply fairy. Another voice answers lower, tight with the quiet contempt of agreement. Dr. Ravi Menon. Good doctor, decent hands, weak spine. Maybe that is where she is comfortable, Menon says. Some programs do not train real trauma. They train urgent care. Sutures, sprains, antibiotics. Holloway laughs softly. Where did she come from anyway? Montana, Idaho. One of those places where the biggest emergency is a deer through a windshield. Emma's jaw tightens once a brief compression, then releases. Her hands do not pause. She does not turn toward the sound. She does not give them the satisfaction of a reaction. The rhythm continues. Count, stack, log. A cheap ceiling vent hums. Somewhere a monitor beeps. A cart rolls past, wheels rattling. The hospital is alive, even when it pretends to sleep. Emma checks the crash cart next, because nobody else ever does it right. She pops open drawers, counts epinephrine ampules, atropine flushes, syringes, airway kits. She confirms the size of each endotracheal tube by touch before she reads the label. She tests the suction with a quick thumb on the valve. She replaces a cracked laryngoscope blade without leaving a note because notes do not fix anything. She fixes it. In the emergency department, time feels suspended between night and dawn. The staff moves slower, voices quieter, like the building itself might break if they disturb it too much. Emma works the way she always works, precise and silent, keeping her posture straight even when no one is watching. She does not slump. She does not lean. She stands like the floor could tilt at any moment, and she might need to stay upright anyway. At 4:12 a.m., the ambulance bay doors slam open hard enough to make the glass rattle. A paramedic barrels in breath-sharp hands pressed to a chest wound. Gunshot to the chest, he calls. Pressure 70/40 and dropping. He is crashing. The trauma bay erupts into motion. Nurses swarm. Monitors beep to life. Someone yanks the trauma shears from a drawer with a metallic snap. Holloway strides in like he owns the air. Move, he says. Get him on the bed. 2 large bore lines. Type and screen. Chest tube tray. Page surgery. Emma steps back to the wall and becomes invisible by practice. She has mastered invisibility here. People see what they expect to see, and Holloway expects her to be small. The patient on the gurney is young, early 20s maybe. Lips tinged blue, eyes wide and unfocused, trying to stay open. His chest rises unevenly, one side lagging the skin between ribs, drawing in wrong. Emma sees it before her mind names it the way she used to see flight deck hazards without thinking. Left side paradoxical movement. Distended neck veins. Trachea beginning to drift. Her hand slides toward the crash cart as if pulled by a wire. Her fingers brush the edge of a drawer. Her thumb finds the familiar grip of a needle packet through the plastic. Then she stops. The air shifts inside her like an internal door slamming shut. Her wrist withdraws. She forces her eyes down. Count. Observe. Do nothing. Holloway's hands move fast. He is competent. Not a genius, but competent. He palpates the 5th intercostal space like the textbooks taught him, marking his spot. He is already talking, already filling the room with certainty. Needle decompression first, he says. Then tube. The monitor alarm screams. The blood pressure drops again, 60/30. The patient makes a sound that is barely a sound, more like air trying to escape a body that cannot hold it. Manon hovers near the foot of the bed, eyes flicking to Emma for a split second, then away. He has noticed before. He just does not know what it means. Holloway inserts the needle. Nothing. No hiss. No relief. For a heartbeat, his confidence wavers. Not enough for anyone to name it, but Emma sees it, the micro-pause, the recalculation that comes too late. He pulls back, shifts higher 2nd intercostal space, mid-clavicular line. The needle goes in and air hisses out under pressure, loud and immediate, like a valve opening in a pressurized compartment. The patient's chest relaxes a fraction. The monitor numbers climb painfully slow, but climbing. 70, 80, 90. Manon exhales. Nice save, Menon says, and there is relief in his voice, like he wants to praise someone for fixing his fear. Holloway strips off his gloves with a snap. Just needed a second to reassess landmarks, he says, already rewriting the moment into a story where he never missed. Emma watches without moving. She says nothing. Her face reveals nothing. She picks up disinfectant wipes and cleans the crash cart with methodical precision, scrubbing dried blood from plastic surfaces as if the act of cleaning can erase the sound of that alarm from her body. The black titanium pen in her pocket catches the overhead light when she bends, then disappears again. When the patient rolls out toward imaging, Holloway claps a nurse on the shoulder like they just won a game. The department settles into that uneasy quiet again. The staff returns to tasks, the adrenaline draining away and leaving exhaustion behind. Emma returns to the supply closet. The cardboard smell grounds her. Disinfectant, paper dust, metal shelving warmed by fluorescent lights. She counts again. Count, stack, log. She holds the rhythm like a rope. By 6:30 a.m., the break room smells like burnt coffee and stale toast. Emma sits alone at a corner table with a protein bar still in its wrapper and a black coffee gone cold. Her phone rests on the laminate surface screen down as if she does not trust it. A nurse enters, soft footsteps, gentle presence. Marcy Vaughn. The kind of nurse who remembers birthdays and always brings an extra blanket without being asked. Her eyes flick to Emma, then away, then back again, like she is deciding whether to risk kindness. "You okay, honey?" Marcy asks. Emma blinks, and for a second, her eyes do not focus. She presses her fingers to the coffee cup, 3-finger grip thumb, anchored for stability. A grip built for holding on when the ground moves. "Yeah," Emma says, "just tired." Marcy nods like she understands tired in a way doctors rarely do. She starts to pour coffee, then pauses when Emma's phone buzzes hard against the table. The screen lights up. A news alert. USS Hawkins completes deployment. Carrier strike group returns to Norfolk. Emma stares at it. She does not blink. She does not scroll. The words sit on her screen like a flare. The break room noise fades as if someone turned down a dial. The hum of the refrigerator. The muted laughter from another table. The distant squeak of shoes on linoleum. It all recedes until there is only the blue light of the screen and the memory that rises uninvited. Red emergency lighting. Alarms screaming through steel corridors. Heat so thick it feels like breathing through cloth. Smoke in the air biting the back of her throat. Her gloves slick with blood that is not hers. A young sailor's face smeared with soot, eyes wide, but trying to hold steady. He is 21, maybe 22. His lips tremble once. He clamps his jaw like he can lock fear behind his teeth. Emma hears her own voice in the memory, calm and controlled, the voice she used when everything was collapsing. "Stay with me," she says. "Stay with me." The ship shudders. Somewhere deep in the hull, an explosion sends vibration through the deck. Overhead, something metallic groans, stressed steel, complaining under pressure. The medical bay feels like a furnace. Sweat pours down her back, soaking her scrubs. Her mask clings to her face like wet cloth. Her hands cramp from dehydration. But they do not shake. They never shake. She is bent over an open chest, her fingers inside a body, holding what she cannot clamp yet, because the instruments are too hot to hold without burning through gloves. Someone shouts her rank through the smoke. Voices overlap, panicked and sharp, and she cuts through them with orders that do not rise in volume, because volume is not command. Command is certainty. In the present, Emma's coffee cup is cold in her hand. Marcy is watching her now, really watching, concern etched into the lines around her eyes. "You military?" Marcy says softly, not accusing, not prying, just naming what she sees. The answer comes too fast, too practiced. "No," Emma says. Marcy does not call her a liar. She studies her instead. The way Emma sits upright, even in exhaustion, the way her shoulders stay squared, the way her gaze is not the gaze of someone who has simply had a hard week. "My brother was Navy," Marcy says after a moment. "You remind me of him sometimes." Emma forces a smile that does not reach her eyes. "I get that," Emma says. She tosses the untouched protein bar into the trash with efficient movements and walks out, before Marcy can offer more kindness than she can carry. Marcy watches her leave, coffee still dripping into a cup, and something in her expression says she has filed Emma away in a place labeled familiar but dangerous. The morning shift brings controlled chaos, the kind that looks manageable until it is not. Emma moves through the department, restocking gloves, checking oxygen tanks, replacing missing syringes. She keeps her head down and her hands busy. Busy hands keep thoughts from getting too loud. At 11:00 a.m., Holloway is in trauma bay. Struggling with a difficult intubation. His technique is solid. His hands are steady. He is a good doctor by any reasonable measure, which makes his arrogance more irritating. The tube resists the patient's jaw tight, and Holloway mutters under his breath like the body is being disrespectful. Emma watches through the glass as she refills a glove dispenser. She sees the angle of the head, the tension in the neck, the placement of the blade. She knows how to fix it in half a second. She does not move. She finishes the gloves. She closes the plastic cover with a click. Her phone buzzes in her pocket. She ignores it. It buzzes again insistently, like someone who will not take silence as an answer. Emma pulls it out, glances at the screen. Unknown number. "We know where you are." The words sit there plain and sharp. Emma's grip tightens around the phone until her knuckles blanch. A pulse of heat runs up her neck, not from fear exactly, but from something older and angrier. The feeling of being tracked, of being cornered, of a door that was supposed to stay shut, rattling on its hinges. She deletes the message. No reply. She slides the phone back into her pocket and forces her breathing into the pattern that has kept her upright for years. 4 counts in, hold. 6 counts out. Across the hall near the vending machines, a man stands watching her. Early 60s. Khaki jacket. Gray at his temples. Civilian clothes that cannot hide the way he holds his shoulders, the way his feet plant on the floor like he expects motion underneath him. He is still, but not relaxed. Still like someone waiting for a hatch to open. Emma feels the weight of his gaze. She does not acknowledge it. She has learned that attention is often a trap. She turns back to her work and walks toward the supply room with the same pace she always has, expression neutral. She refuses to give anyone a clue that her heart has picked up speed. The man does not follow. Not yet. Inside the supply room, Emma closes the door and leans her back against it. The cool metal presses into her spine. The smell of cardboard and disinfectant fills her lungs. She shuts her eyes and steadies her breathing. 4 counts in. Hold. 6 counts out. The past tries to push through. Anyway. Heat. Unbearable heat that turned air into a heavy thing. The medical bay aboard USS Hawkins, 3 decks below, a propulsion spacefire that filled corridors with smoke and fear. Casualties stacked in rows, every surface taken, bodies everywhere, some alive, some not. She remembers the thermometer reading on the bulkhead numbers that did not make sense, 136 degrees, then higher. She remembers sweat dripping off her chin into a patient's open abdomen. She remembers a corpsman passing out mid-task and being dragged aside without ceremony because there was no time to grieve unconsciousness. She remembers the pen, the black titanium pen clipped to her collar, writing notes on damp paper because electronics failed in the heat. She remembers writing medication doses, writing times, writing names, writing who went where, writing the small details that make the difference between organized survival and a pile of dead bodies. She remembers a sailor with shrapnel in his femoral artery. The blood came fast and bright, impossible to keep up with. She clamped, sutured, transfused, packed, tried. She remembers his eyes locked on her face, trusting her like faith. "You are going to be okay," she told him. "You hear me. Stay with me." He tried. God, he tried. His fingers gripped her glove like it was an anchor. His mouth moved like he wanted to say something, and she leaned in close to hear, because she refused to let him die unheard. The words never made it out. His pulse faded under her fingertips, and she held his hand anyway, because if she let go, it would have felt like surrender. Emma opens her eyes. The supply room is cool, quiet, solid. The present asserts itself in layers. A stack of gauze, a box of saline bags, a shelf label crooked by a careless hand, a scuffed mop bucket outside the door. She pushes off the door and returns to work because movement is easier than thought. Out in the hall, the man in the khaki jacket lifts a phone to his ear and turns slightly away from passing staff. His voice is low, but Emma catches a fragment as she walks by like a hook catching fabric. "Yeah," he says, "it is her, I am certain." Emma does not stop. Her pace stays even. Her face stays blank. Inside her chest, her heart hits harder. The hospital continues around her, indifferent. Phones ring. A nurse laughs. Someone wheels a patient toward radiology. Life proceeds like the world has not tilted. At 1:15 p.m., Emma takes her lunch break because it is required, not because she wants it. The cafeteria is too bright, too loud, too full of normal people chewing food like their hands do not carry blood memory. She buys a salad she will not eat and a bottle of water she sips without tasting. She sits at a table near the wall, back to the window, a habit she never explains. Her fingers laced together, steady, resting on the tabletop. She stares at nothing and listens to everything. The air conditioner kicks on, sending a cold draft across the room. She welcomes it the way a drowning person welcomes a gasp of air. Her phone stays silent. That does not comfort her. Silence is often just the space before impact. A tray clatters somewhere. A chair scrapes. A child laughs at a nearby table. Emma keeps her gaze lowered, calm mask locked in place. Footsteps approach from behind her, measured, deliberate. The gait of someone who has spent decades walking on steel decks, adjusting without thinking to motion beneath his feet. Emma's shoulders tighten. Her fingers stop moving. She does not turn. The footsteps slow, then stop directly behind her chair, close enough that she can smell sea salt clinging to fabric that has traveled too many ports. Emma closes her eyes for half a second. Inhales, holds, exhales. Then she opens them and waits without looking back. The footsteps stop close enough that Emma can feel the warmth of a body behind her chair. She keeps her hands laced, fingers still, knuckles pale against the tabletop. Her eyes stay on the salad container as if reading the label might anchor her to something harmless. A tray shifts, plastic creaks. Then a voice, low and sure, like it has given orders over engines and alarms. Emma. No doctor here says her name like that. No one says it like it carries rank. Her breath catches once controlled, then settles. She does not turn yet. You've got the wrong person, she says, voice. Even American flat. No tremor. A chair scrapes across the floor behind her. The man sits without asking. He does it with the calm entitlement of someone who has spent his whole adult life sitting down in rooms he does not own because the mission mattered more than manners. I told myself it couldn't be you, he says. Not here. Not in a place like this. Emma's jaw tightens. She turns slowly like a turret moving and meets his eyes. He is older than she remembers. The lines around his mouth are deeper, the skin at his throat looser, but his gaze is the same as it was under red lights and smoke. Clear, sharp, unforgiving. Captain retired Jack Harlan. His hair is more gray than brown, now cut short out of habit. His hands are folded neatly on the table, fingers scarred at the knuckles. Civilian clothes try to soften him. They fail. Emma's stomach drops anyway, because memory is not polite. It does not wait for her to invite it in. It walks in and sits down, the boots on the table. You're mistaken, she says again. Harlan watches her for a moment without blinking. In the background, cafeteria noise continues, faint and ordinary. Forks against plates. A soda machine humming. Someone laughing at a joke that is not theirs to keep. I watched you hold a kid's aorta shut with your fingers for 40 minutes, Harlan says, as if he is reading a report out loud. No clamp, no balloon, no backup. Just your hands and your voice. You told him a penguin joke. He laughed. He lived because you refused to let him go. Emma feels the room tilt. The edges of her vision tighten. The fluorescent light seems too bright. I don't know what you're talking about. Harlan leans in slightly, lowering his voice so only she can hear. Lieutenant Commander Emma Keller, service number 38160421. Hearing the numbers lands like a physical strike. A coded door in her head opens on its own. Emma stands so fast her chair legs scrape hard against the floor. Nearby heads turn. Conversations soften. People sense tension the way animals sense weather. Stop, she says, sharp but quiet. Do not say that here. Harlan does not move. His hands remain folded. He looks up at her like he has always looked up at her, not with superiority, not with pity, but with a hard kind of respect that does not ask permission. You saved 53 lives during the Hawkins fire. He continues, still controlled. You operated for 16 hours in heat that knocked out half your team. You kept casualties under 10%. That is why I know it is you. Emma can feel eyes on her now. Hospital staff at nearby tables have paused mid-bite. A nurse in blue scrubs stares openly. A resident whispers something into another resident's ear. Emma forces her shoulders down. She forces her face into neutrality. Her voice drops. You need to leave. Harlan's gaze does not waver. Why the hell are you counting bandages in North Carolina? I work here, she says, clipped. That isn't an answer. Emma's hands curl at her sides. She feels the urge to run. Not a panicked run. A tactical exit. The kind of movement that gets you out of a bad space before it collapses. I'm not that person, she says. Harlan nods once, as if acknowledging the statement. Then he does what he always does. He presses on the weak point until the truth shows itself. You saw a tension pneumothorax this morning from across the room, he says. I watched you. Your eyes went to the chest wall before Holloway's hands even got gloves on. Your body moved toward the cart and stopped. You are still that person. You are just locked behind a door. Emma's lips press together. She feels heat rise under her skin, not from embarrassment, but from anger. Anger at him for saying it. Anger at herself because he is right. I did nothing, she says. You did not need to, Harlan replies. You assessed. You calculated. You held the line. The same way you did on board. Emma leans in, slightly lowering her voice further. If you came here to drag me back, you wasted your trip. Harlan's expression hardens. The Navy's looking for you, Emma. Her pulse jumps. The cafeteria sounds vanish for a second, replaced by the distant wail of alarms that are not here. She forces the memory down. I'm not Navy, she says too quickly. Harlan's eyes flick to the pen clip peeking from her pocket. He does not mention it. He does not need to. You think you can erase yourself by stacking gauze, he says. Emma's throat tightens. I'm done, she says. I'm done saving people who run toward explosions. Harlan studies her face like he is reading a map in low light. Then why did you do it again today? He asks. Emma straightens. Her chair stands crooked behind her. She reaches for her salad and throws it away without looking like the food has insulted her. She turns to leave. Harlan does not chase her. He does not raise his voice. He only speaks loud enough to reach her back. They need you. Emma stops for half a second. The muscles in her back seize. She does not turn. Find someone else, she says. There is no one else, Harlan replies, and she hates him for how calm he is. Emma walks out of the cafeteria with a controlled pace that fools anyone who has never run from ghosts. She makes it to the hallway before her hands start to shake. Not much. Just a faint tremor in her fingers like a signal trying to break through static. She turns into the nearest stairwell and pulls the heavy door shut behind her. Concrete walls. Dim light. The smell of dust and cleaning chemicals. A place built for movement and emergencies, not for collapsing. She grips the metal rail until her knuckles turn white. She bows her head once eyes closed and forces air into her lungs. 4 counts in, hold, 6 counts out. Her heartbeat slows enough to hear other things again. The distant murmur of the hospital. A cart rolling somewhere above. The soft buzz of the stairwell light. Then the faces come anyway. 6 of them. Not as a montage. Not as a blur. Each one sharp and specific, like her brain has saved them in high definition and refuses to delete the files. A young sailor with soot on his cheeks and a torn uniform collar. A woman with a wedding band still on her finger, skin gray under the heat. A kid with his dog tags clenched in his fist because he was afraid someone would lose him in the chaos. A corpsman with chemical burns around his mouth, trying to breathe through pain. Their names line up in her head like a roster she never stops carrying. She opens her eyes and stares at the concrete wall until it stops moving. A phone buzzes in her pocket. Her stomach drops. She does not want to look. She looks anyway. Unknown number. Tomorrow, 0800. You do not get to hide anymore. Her fingers tighten around the phone. The shake in her hands gets worse, then she crushes it down with force. She deletes the message, like deletion can erase the sender. She takes another breath deeper this time. Her shoulders settle. Her grip loosens on the railing. Control, she tells herself. You have control. She pushes the stairwell door open and steps back into the hallway, face reset. People pass her without noticing anything wrong. That is what she is counting on. She walks to the supply closet because the supply closet is safe. It is quiet. It is predictable. It asks nothing of her except numbers. Inside, she opens a box of suture kits and begins again. Count, stack, logagik. Her hands steady because she wills them steady. Outside the closet down the hallway near the vending machines, Harlan waits like he is listening for a signal. He sees Emma disappear into the closet, and he does not follow. He only pulls out his phone and makes a call with his back to the wall. Contact made, he says. She is resistant. A pause. His jaw tightens slightly. No, she will not come willingly. Another pause. His gaze shifts toward the emergency department doors. Understood. Send the file. I will be ready. He ends the call and stays where he is patient as a man who has watched hurricanes approach from open water. The day moves on. Morning becomes afternoon in small, exhausting increments. Emma keeps to the edges. She restocks. She cleans. She logs supplies. She keeps her face neutral when Holloway passes her in the corridor, still puffed up from his near save earlier. She keeps her mouth shut when Menon glances at her like he is trying to solve a puzzle, but is afraid of the answer. At 2:30 p.m., Marcy catches Emma near the medication room. "You sure you're okay?" Marcy asks, keeping her voice light. Emma nods. "Just tired." Marcy watches her hands. The steadiness. The economy of motion. "You ever think about sleeping?" Marcy asks gently. Emma gives her a small smile that is almost real. "Sometimes," she says. Marcy steps closer, lowering her voice. "That man," she says. "The one in the cafeteria. He had a look on his face like he knew you from somewhere hard." Emma's spine stiffens. "He's nobody," Emma says. Marcy does not argue. She nods like she understands what it means when someone calls a hurricane nobody. "Okay," Marcy says, "if you need anything." Emma turns away before gratitude can show on her face. Gratitude feels dangerous. It makes her want to stay. Staying is how people get hurt. At 3:47 p.m., the emergency department scanner crackles. The charge nurse's voice comes through first, strained higher than usual. "Multiple vehicle pileup on Highway 17, she says. "Mass casualty. 10 victims inbound. 4 minutes." The department changes instantly. The air shifts. Conversations stop. Feet move faster. Fear enters the room not as screaming, but as tightened jaws and widened eyes. Holloway looks up from a chart. For the first time all day, his confidence falters. "How many critical?" he asks. "At least 6, the charge nurse replies. "Maybe more." Manon is already on the phone with the nearest trauma center. He listens for 3 seconds, then his face falls. "They're on diversion," he says. "Full capacity." Holloway's mouth tightens. "Then we handle what we can," he says, trying to sound like command. He points at bays with a pen like pointing can create resources. "Clear bays 1 through 4. Call respiratory. Page anesthesia. Get blood ready. Somebody call imaging." People move, but the movement has panic in it. Cape Haven is not built for this. It is built for heart attacks and broken hips and pneumonia. It is not built for a flood. Emma stands near the supply station, hands on an open drawer of IV start kits. She listens to every order, every response, every missing piece. She does the math in her head without trying. How many nurses on this shift? How many monitors? How many ventilators? How many trauma trays actually stocked? How many minutes before the first patient bleeds out if nobody gets control? She does not feel fear in the way the others do. Fear is loud for them. For her, it is quiet and cold and precise. It shows up as a list. Too few hands, too little blood. No trauma surgeon, no time. Holloway calls out assignments again, voice rising. "Menon, you take Bay 1. "I will take Bay 2. A resident asks, voice thin. "What about Bay 3 and 4? Holloway hesitates, then fills the gap with bravado. "We will rotate," he says. Emma watches him like she is watching a man try to stop a flood with a towel. The ambulance bay doors slam open. The sound echoes down the hallway like a warning shot. A paramedic's voice cuts through the air, urgent and ragged. "We've got multiple," he shouts. "Flail chest. Possible pneumothorax. Closed head injury. This one is coding." Gurneys roll in one after another, wheels squealing on linoleum. Blood streaks sheets. A teenager's eyes are open, but not seeing. A woman coughs pink foam into an oxygen mask. A man screams until his voice cracks, and then he makes a sound that is worse because it is quieter. The system begins to bend. Emma sets an IV kit down on the counter with careful control, like she is placing a weapon on a table. Her eyes move across the room. She counts bodies. She reads skin color. She watches chest rise. She listens to breath sounds without a stethoscope, because she has done this in places where tools did not exist. The noise swells. Orders overlap. Someone calls for a defibrillator. Someone yells for blood. Someone asks where the chest tube tray is, and a nurse answers that it is missing a sterile field. Holloway's voice sharpens into strain. "Bay 1, take the flail chest," he snaps. "Bay 2, head injury." But the words are not enough. The room is too fast, too full. People move in different directions at once, colliding, stepping over each other's lines of sight. A nurse tries to start a line and fails because the vein collapses. Another nurse does compressions on a coding patient and her arms already shake with fatigue. Emma feels the moment the department crosses the line from chaos into collapse. She steps forward, not quickly, not dramatically, just one step into the center where people can see her if they look. Her voice is quiet when it comes out, but it cuts through the noise like a blade through cloth. Stop! A few people do not hear. She says it again, same volume, more weight. Stop! Heads turn. The room hesitates a fraction of a second of suspended motion. Not because they understand her authority, but because something in her tone feels like gravity. Emma's gaze locks on Holloway. His eyes meet hers, confused, irritated, then something else. Something that looks too much like relief. Her hands remain at her sides, steady, ready. The department holds its breath. The room holds its breath. For a fraction of a second, even the monitors seem quieter, as if the building is listening. Emma stands in the center of the emergency department with her hands at her sides and her eyes moving the way a pilot's eyes move across an instrument panel. Not frantic, not scattered, ordered. Holloway's mouth opens, ready to reclaim the air. "Who do you think you are?" he starts. Emma does not raise her voice. "Dr. Menon," she says, and her tone lands like a hand on a shoulder. Bay 1, flail chest. Needle decompression first. Left, then right. Then chest tubes. Menon blinks. His brain lags behind her certainty, then catches up. "I can do that," he says, and he is surprised by his own words. Emma points again, clean and precise. Resident in the green cap. Femur fracture to the procedure room. Traction splint now. Before imaging. The resident starts to speak. "I was told to send him to X-ray," she says, voice tight. Emma's eyes flick to the patient with the bent leg, to the way his skin has started to gray at the edges, to the way his screaming is already losing strength. His pain is not the emergency, Emma says. His blood loss will be. "Splint first." The resident swallows. "Yes, ma'am," she says, then flinches at what she called her and moves anyway. Emma turns to the nurse doing compressions, sweat shining on her forehead, arms shaking with effort. "Switch at 2 minutes," Emma says. "You're burning out." The nurse nods like she has been waiting for someone to notice. Emma's gaze lands on the teen boy on the gurney, chest barely rising, lips, pale eyes rolling. "Airway," she says. A respiratory therapist steps forward, hands full, eyes wide. "We have one vent open," the therapist says. Emma nods once. "Then we use it for the person who can survive if we act." "Now," she replies. Her eyes finally lock on Holloway. "The coding patient comes with me," she says. Bay 3. Holloway's face tightens. His pride tries to step forward. It is a reflex, not a choice. "This is my department," he says. Emma does not argue. She does not posture. She simply states reality. "You have too many patients and no map," she says. "I have a map. Move." A beat. Holloway's eyes flick around the room, the chaos he cannot grip, the staff looking at him with fear and desperation. He is not stupid. He sees that his ego will not stop the bleeding. "Fine," he snaps. "Bay 3 is yours." Emma turns away before he can take the word back. She gestures to 2 nurses. "You and you," she says, "bring the code cart. Bring blood. Bring suction. Now." They move, relieved to have a clear lane. The coding patient rolls into trauma bay 3, chest rising wrong, even under bagging. The monitor flashes a rhythm that is not a rhythm. Just electrical noise. A nurse is already calling out compressions. 32, 33, 34, she counts. Voice strained. Emma steps in. "Swap," she says. The nurse steps back, panting. Emma's hands go to the sternum, and the first compression is a controlled strike. Hard. Centered. Deep enough to matter. Her shoulders stay stacked over her wrists. Her body weight does the work. It looks almost effortless, which is what makes it frightening. 2 large bore IVs, she says between compressions. 18 gauge, type O negative now. The nurse hesitates. "We only have 2 units in the fridge," she says. Emma does not stop compressing. "Then you start them and you call for more," she replies. "And you do not wait to be told twice." The nurse moves. Emma's eyes flick to the neck. Jugular veins full. Trachea drifting. Skin clammy. the chest rising unevenly even with bagging. Her brain clicks into a pattern she knows the way her tongue knows her own name. Bilateral tension pneumothorax, she says, and it is not a guess. The nurse beside her stares. Both the nurse repeats disbelief mixing with hope. Both Emma confirms. She stops compressions long enough to check for a pulse. Nothing. She starts again. One of the techs fumbles with a needle kit, hands slick with sweat. "We do not have the right catheter length," the tech says. Emma looks up. Her eyes are calm. "Give me what you have," she says. A 14-gauge needle packet lands in her palm. She tears it open with her teeth while compressing with her other hand. The move is brutal and practiced. The tech freezes for a half second, then rushes to expose the chest. Emma stops compressions. "Second intercostal space," she says. Mid-clavicular, left side first. She feels the landmarks through skin and sweat, then drives the needle in straight and confident. The moment the pleura gives air, explodes out under pressure, a violent hiss that sounds like a seal breaking. The monitor stutters. Not life yet. A twitch. Emma does not wait. She moves to the right side. "Same spot," she says. The needle goes in. Another hiss, louder this time, as if the body has been holding its breath for too long. The monitor blips. A thin line turns into a rhythm. Weak, but present. The nurse's face changes. It is the look people get when they realize they were holding a death certificate and someone snatched it back. "Pulse," the nurse says, hand on the carotid. "I have a pulse." Emma exhales once shallow controlled. "Sinus tach," she says, eyes on the monitor. "Keep him bagged. Chest tubes now." The nurse looks around, frantic. "We do not have thoracic trays stocked," she says. "They are in the OR." Emma's gaze cuts toward the door. "Then you go to the OR and you take a thoracotomy kit if that's what it takes," she says. "And you run like your job depends on it." The nurse does not argue. She runs. Emma turns back to the patient. Blood pressure numbers crawl up, still dangerous but moving. 2 liters wide open, Emma says. "Warm fluids. Keep the temperature up." A tech fumbles with the warmer. "It is not working," he says. Emma's eyes flick to the warmer, then to a heat blanket. "Use the blanket," she says, "and get the warmer working after." We fix one fire at a time. Outside the bay, the department is still moving, but now it moves with lanes instead of collisions. Emma can hear Menon's voice over the noise, shaky at first, then steadier. Needle decompression left Menon calls. Now right. A patient screams. A nurse shouts for help. Someone calls out blood pressure. The department is still a storm, but it has a center now. Holloway storms into trauma bay. 3 face flushed with effort and anger, eyes landing on Emma as if she is trespassing. "We need you in bay 2, he says. "Head injury is crashing." Emma does not look away from her patient. "I'm busy," she says. "Handle your airway." Holloway's jaw tightens. "I'm telling you," he says, voice rising. Emma finally looks at him. Her eyes are flat. "Then listen carefully," she replies. "You need to intubate, and you need to hyperventilate only if you see signs of herniation. Otherwise, you will drop perfusion and you will kill him. Do you understand the difference?" Holloway's mouth opens, then closes. He is furious because she is right, and because she said it like it was obvious. "Yes," he says, clipped. "Then go," Emma answers and turns back to the chest. The nurse returns breathless, carrying a tray with sterile packs and instruments that look like they have never been used here. She nearly drops them on the counter. "I got it," she pants. Emma nods once. "Open," she says, "left side first." The nurse's hands shake as she tears open sterile packaging. "I have never placed a chest tube," the nurse admits, voice thin. Emma does not soften. She does not harden, either. She becomes precise. "You are about to," she says. "You do exactly what I say." She positions the nurse. 5th intercostal space, Emma instructs. Mid-axillary line. Feel the rib. Go above it, not below. The nerves and vessels run under. You cut under and you cause a different problem. The nurse swallows, fingers trembling. Emma takes the scalpel and makes the initial incision herself, quick and clean. Blood beads at the cut. "Now blunt dissection," she says, handing the clamp to the nurse. "Spread, do not poke." The nurse spreads. Tissue yields. Emma watches the nurse's hands like a hawk watches wind. "Feel the rib," Emma says. Stay on the rib. Over the top. The nurse finds it breath-held. There, Emma says. Now go in. You will feel a pop. That is pleura. Do not stop when you feel it. The nurse pushes. Resistance, then release. I felt it, the nurse whispers. Good, Emma says. Finger sweep. Confirm you are in the space. Then tube. The nurse slides a finger in face tight with concentration. I'm in, she says. Tube, Emma commands. The chest tube slides. Bubbles appear in the chamber. Air and blood escape the body. The oxygen saturation climbs. 74, 81, 93. Secure it, Emma says. Now right side. The nurse's hands are still shaking, but less. Fear is still there, but it has a shape now. It is something she can hold. They repeat the procedure on the right. Emma coaches every movement, correcting grip and angle, controlling the pace. The patient's blood pressure rises again, slow but unmistakable. Okay, Emma says at last. He lives long enough to get a CT. The nurse stares at the monitor as if it is a miracle. Emma strips off her gloves. Her hands are smeared with blood that is not hers. Her nails are clean anyway, a detail that does not make sense unless you have lived in places where infection is another enemy. She steps out into the hallway. The department looks different. Still crowded. Still loud. But no longer collapsing. Menon emerges from Bay 1, sweat darkening his collar. His eyes are wide, cheeks flushed. Flail chest is stabilized, he says, almost startled by the words. Chest tubes are in. He is breathing. A resident passes with the femur patient leg splinted traction in place. The patient's screams have dropped to a low moan and his skin color is better. Splint is on the resident, tells Emma, like reporting to a superior she does not understand. He is going to imaging. Emma nods once. Approval without praise. Holloway appears near Bay 2 holding a laryngoscope like it offended him. His hair is damp. His jaw is tight. His eyes flick to Emma and away. He is intubated, Holloway says. We are controlling ventilation. Emma's eyes scan the room, then land on the teen boy now on a monitor oxygen mask, strapped tight, respiratory therapist leaning close. How is he? She asks. Breathing, the therapist says. Weak, but breathing. Emma's chest loosens by a fraction. Not relief, just a slight release of pressure. She moves to the charge nurse station, where the charge nurse is staring at a triage board covered in names and quick notes. Who is left unassigned? Emma asks. The charge nurse looks at her like she is seeing her for the first time. We have 2 more ambulances inbound, the charge nurse says. Minor injuries mostly. 1 possible internal bleed. Emma points to a curtained bay. Put the possible bleed there, she says. Fast exam as soon as they arrive. If positive, we call transport. If negative, we monitor and repeat. Do not let them sit in the hall because they look stable. The charge nurse nods, swallowing. She is following now, not questioning. Menon steps closer, voice low. How do you know all of this? He asks, and he does not mean the medicine. He means the calm. Emma looks at him once. Because I have had to, she says. A nurse passes carrying bloody linens. Another wheels a portable X-ray machine. The floor is streaked where gurneys rolled in too fast. Staff members move like they are underwater, exhausted, but their eyes are sharper now, less panicked. Marcy appears at Emma's elbow, cheeks flushed, hands gloved and smeared. You just saved that man, Marcy says, voice thick with awe and something close to anger, like she is furious the hospital never knew who Emma was. Emma keeps her gaze on the triage board. He was dying, she says. We fixed what was killing him. Marcy watches her for a beat. And you, Marcy says quietly, are you okay? Emma's mouth tightens. I'm working, she replies. Marcy nods, not offended. She knows that is Emma's version of survival. A paramedic approaches with a clipboard, sweat running down his temples. Doc, he says, eyes on Emma. We got another one in the back. Belly trauma. He is pale, and his pressure is dropping. Emma turns immediately. Bring him to Bay 4, she says. Now. She walks with the paramedic, not rushing, but moving with purpose. People step out of her path without realizing they are doing it. Bay 4 smells like antiseptic and blood like every other bay right now. The patient is a man in his 50s, eyes half closed, skin damp. His abdomen is distended and tense. He tries to speak and can only manage a breath. Emma places a hand on his shoulder, firm. "Sir," she says, "look at me." His eyes flutter open. "My name is Dr. Keller," she says. "You are going to keep breathing. Do you understand?" He nods weakly. Emma turns to the ultrasound. "Fast," she says. A resident moves to perform it, hands jittery. Emma watches the screen. Free fluid collects where it should not. The dark crescent appears like an omen. "Positive," Emma says. "Call for transport." He needs a trauma center. Holloway appears at the doorway, face tight. "We cannot transport everyone," he snaps. They are on diversion. Emma does not look away from the patient. "Then we stabilize, and we push until someone takes him," she says. "Call the next facility." Then the next. You do not accept no as a final answer when a man is bleeding inside. Holloway's nostrils flare. "You are acting like we are in combat," he says. Emma finally looks at him. "This is combat," she replies. "The enemy is time." Holloway holds her gaze for a second. Something shifts behind his eyes. Not acceptance. Not yet. But the beginning of understanding that the rules he lives by are not the only rules. Manon steps in, voice careful. "Transport is calling New Hanover," he says. "They might open one bed." Emma nods once. "Good," she answers. 2 large-bore IVs. "Start blood if we have it. Keep him warm. Monitor his mental status every 5 minutes. If he drops, we do not wait." The resident beside the patient swallows. If he drops, the resident begins, "Do we intubate?" Emma's eyes flick to the man's lips, to the way he is starting to breathe faster. "If he cannot protect his airway," she says. "Yes. But you do not intubate because you are afraid. You intubate because it is necessary." The resident nods, absorbing it like a lifeline. Emma steps out again, scanning the department. The worst wave has passed, but the aftermath is where people make sloppy mistakes. The staff is exhausted. Hands get clumsy. Minds get lazy. That is when patients die. She moves from bay to bay, checking chest tube seals, confirming pulse oximetry, watching for the subtle signs of decompensation. She corrects a nurse's medication dose without embarrassing her. She adjusts a monitor alarm threshold. She forces a resident to drink water when his face goes too pale. Holloway watches from a distance, face unreadable. Menon watches more closely, eyes searching for the moment where Emma becomes human again. Marcy watches with something like protectiveness now, as if she has decided Emma belongs to her and the hospital does not deserve her. By 5:10 p.m., the emergency department is still full, but the panic has bled out of it. The noise has changed. Not screams and shouted orders. Now it is the steady chatter of work, the sound of people doing what they know they must do. The charge nurse approaches Emma at the station, voice low. "No deaths," she says, as if she cannot believe it. Not one. Emma's throat tightens for a second. She keeps her face neutral. "Good," she says. The charge nurse looks at her hands, then up to her face. "We need to write a report," the charge nurse says. "Administration is going to ask questions." Emma nods. "They can ask," she replies. Manon steps closer, eyes still wide. "You ran that like you were directing an air wing," he says, and there is no mockery now. Only awe and fear. Emma looks at him, then away. "I ran it like people were going to die if nobody did," she answers. Holloway finally approaches, shoulders squared, pride still on him like a stiff coat. He stops in front of Emma, blocking her path. "I want to know who you are," he says. Emma's eyes lift slowly. "I told you," she replies. "Dr. Keller." Holloway's jaw tightens. "That is not what I mean," he says. "No one walks into my department and takes over like that unless they have done it before." Emma holds his gaze. She does not blink. "You did good work today," she says instead, and the words land heavier than praise. They land like an assessment. "You kept your airway patient alive. You did not panic. Remember that." Holloway looks momentarily thrown off. He expected a fight. He expected an apology. He did not expect evaluation. "You do not get to talk to me like you are my superior," he says, voice rising again. Emma's expression stays flat. "Then do not act like someone needs to be superior," she replies. "Act like someone needs to be competent." Holloway's face flushes. He looks like he might snap back. Then he glances past her at the bays, at the patients still alive, at the staff watching him now with a new measure in their eyes. He swallows. Not humility exactly, more like self-preservation. Fine, he says and steps aside. Emma walks away, the conversation done, because she decides it is done. She goes back to the supply closet first, because it is habit. She closes the door and leans against the metal shelving. Her chest rises and falls more heavily now that she is alone. Sweat cools on her skin, turning into a chill. Her hands shake slightly. She looks at them annoyed, then forces them still by tightening her fingers around the edge of the shelf until the tremor stops. Control returns like a trained animal coming back to heel. She breathes in the pattern again. 4 counts in. Hold. 6 counts out. The smell of cardboard does what it always does. It pulls her out of memories and into inventory, into tangible, countable things. Gauze exists. Suture exists. Numbers exist. The past does not. A knock hits the door sharp. Emma straightens immediately. "Dr. Keller," a voice says from the other side. A security guard, she recognizes the tone. "Administration wants you." Now, Emma closes her eyes for half a second. She can feel the weight of the hospital shifting. The system does not like surprises. Systems respond by pulling on chains. She opens the door. The hallway is brighter than the closet. The air smells like disinfectant and something metallic like blood that has been scrubbed but not erased. Marcy stands a few feet away, waiting as if she anticipated this. "They are looking for you," Marcy says softly. Emma keeps her expression neutral. "They always are," she replies. Marcy takes a step closer, voice lowering. "There is a man downstairs," she says. "Not Harlan. Someone else. Military. White uniform." Emma's pulse ticks up. She does not let it show. Where Emma asks. "Lobby," Marcy answers. He is not sitting. He is standing like he owns the floor. Emma stares down the hallway toward the elevators where the doors open and close with indifferent chimes. Her mouth goes dry. For a moment, she can smell smoke that is not here. She forces a breath into her lungs. 4 counts in. Hold. 6 counts out. Then she walks steady and upright toward administration, toward the lobby, toward whatever has stepped into the hospital's light. The elevator doors open onto the lobby, and the first thing Emma notices is the stillness. Not the quiet of a hospital between shifts, but the kind of stillness that comes when people sense a storm and step back from the windows. A man in a white service uniform stands near the front desk, perfectly upright, hands clasped behind his back as if the floor belongs to him and the building was only built to hold his shadow. Rows of ribbons sit across his chest like a second language. His hair is silver, his face carved into calm authority, and his eyes scan the room with the same precision Emma used in the trauma bays. Rear Admiral Thomas Kearns. Beside him, Jack Harlan waits in civilian clothes, his posture giving him away anyway. A third man stands a pace behind them, lean and watchful in a suit that does not fit like a suit. His gaze is too sharp for hospital politics. His hands stay near his jacket, not fidgeting, just ready. The hospital administrator rushes forward, forcing a smile that does not reach his eyes. "Sir, this is a civilian facility," the administrator begins. "You cannot just arrive and demand access to our staff." Kearns turns his head slightly, the way a ship turns toward a sound. "I am not here to tour your facility," he says. "I am here to retrieve a Navy surgeon." The administrator's smile falters. "This is Cape Haven Medical Center," he says, voice tightening. "If you have a concern, you can submit paperwork through our legal department." Kearns's eyes flick past him and land on Emma. The air changes. Emma feels it in her skin like pressure shifting before a door opens. For a heartbeat, the lobby lights feel too bright. The smell of antiseptic turns sharp. The sound of a rolling wheelchair becomes a distant rattle in a corridor far away. Kearns walks toward her with measured steps. People in the lobby part without being asked. A nurse freezes mid-stride. A security guard hesitates near the entrance, unsure if he is supposed to intervene or salute. Emma does not move. She has learned that if you step back first, you are already losing ground. Kearns stops a few feet from her. His expression remains controlled, but recognition is there undeniable. "Lieutenant Commander Emma Keller," he says. Emma's mouth goes dry. I am not a lieutenant commander, she answers. Kearns's gaze does not waver. You are on involuntary medical leave, he says. Your status did not end because you changed zip codes. The administrator steps in trying to regain control. She is employed here, he says. If she is being harassed, I will call law enforcement. The suited man behind Kearns shifts his weight. He does not reach for anything. He does not need to. Kearns does not look at the administrator. Call whoever you like, he says. This is federal. Emma feels eyes on her from every direction. Staff members gathered near the lobby entrance, drawn by the presence of uniforms and certainty. Marcy stands near the coffee kiosk, hands clasped, tight face, pale. Holloway and Menon have drifted in from the emergency department, still wearing the tired look of a mass casualty response. Holloway's eyes bounce between Emma and the Admiral, like he is trying to reconcile two impossible images. Emma keeps her face neutral. I'm done, she says, voice low. You can't take me. Kearns' eyes narrow by a fraction. I can, he replies, and I will. Harlan steps slightly to the side, letting Kearns own the confrontation. His gaze stays on Emma, not pleading, not threatening, just watching her like a man who has waited too long for this moment. Emma's jaw tightens. She turns her head a fraction, addressing Kearns, without giving him the satisfaction of a full reaction. You've got the wrong person, she says. Kearns' voice remains calm. The Hawkins incident investigation concluded, he says. You were cleared of negligence. Your resignation was denied due to critical operational shortage. Your medical leave ends today. Emma feels her pulse climb. Heat creeps up her neck. The words land like restraints snapping into place. You can't deny a resignation, she says. Kearns finally lets a trace of impatience enter his tone. The secretary did, he replies. Your paperwork has a signature that outranks your feelings. The suited man steps forward and opens his jacket just enough to show a badge, then closes it again. It is not a threat. It is a fact. Emma understands at once who has been texting her. Not a ghost. Not paranoia. A tracking net with a human face. Her fingers curl once, then relax. Kearns' voice drops a little, not softer, just more focused. A special operations operator was injured during a classified mission in the Atlantic, he says. He is aboard USS Valiant. Catastrophic internal trauma. The ship's medical bay is compromised. Emma holds his gaze. Send another surgeon. Kearns does not blink. There is no one else who can do this under the conditions we have, he says. Emma's breath catches at the word conditions. Kearns continues with clinical precision, each detail a weight he sets down in front of her. Electrical fire near the ventilation trunk, he says. Smoke contamination in the medical spaces. HVAC is failing. Temperature in the bay is 124 degrees and rising. Backup power is unstable. Limited blood products. Limited redundancy. The lobby seems to tilt. For a second, she is not in North Carolina. She is 3 decks down under red lights, and the air is thick and hot and full of smoke that tastes like melted insulation. Emma forces her vision back into focus. Find someone else, she says again more sharply. Kearns' expression hardens. There is no one else, he repeats. If you refuse, he dies. The administrator makes a strangled sound. You cannot say that he protests. Kearns turns his head, finally granting the man a glance. I can say it because it is true, he replies. Your facility stabilized 10 patients today because she took command. She does not get to pretend she is not who she is. Holloway stiffens at the words. Menon's eyes drop to the floor, shame and confusion mixing. Emma feels the attention like heat on her skin. Her hands stay at her sides. Her posture stays straight. She refuses to look cornered, even as the walls close in. Kearns reaches into the folder he carries and removes a photograph. He holds it up, not offering it to her, just showing it. A young man, late 20s, unconscious on a gurney, skin pale under harsh light. Tubes. Monitors. Blood bag hanging like a clock. Emma's throat tightens. Chief Petty Officer Alex Mercer Kearns says, 29. Wife. 2 infants born 3 months ago. He has not held them. Emma stares at the photograph without reaching for it. Why are you showing me this? She asks. Kearns' voice stays blunt. Because you need to see who you are abandoning. Her stomach turns. That's not fair, she says. Kern's eyes remain steady. War is not fair, he answers. Medicine is not fair. And I did not come here to comfort you. I came here to save him. Emma's shoulders lift with a sharp inhale. She feels anger rise hot and bright. You don't get to use him as leverage, she snaps. Kearns holds his position. I do, he replies. Because you are alive. He might not be. And the difference is your hands. Harlan speaks for the first time, voice low. Emma, he says, careful. You know what those conditions do. You know what happens when you wait. Emma whips her gaze to him. You set this up, she says. Harlan does not deny it. I found you, he replies. I made sure the people who needed you knew where to look. Her eyes flick toward the suited man, the badge, the unseen net. The texts. We know where you are. Tomorrow, 800. Not a threat. A schedule. Emma's breathing tightens. She forces it back into the pattern, but the pattern strains under the pressure. Kearns watches her with the patience of someone who has seen fear in 1,000 forms. You do not have to like it, he says. You have to move. Emma's voice drops. I have rights, she says. Kearns leans in slightly. You have orders, he replies. A security guard takes a hesitant step forward. The administrator raises a hand as if to stop him, then lowers it again, uncertain which authority is about to win. Emma's gaze drifts past Kearns to the staff watching from the edges. Marcy's eyes are wet. Holloway's face is tight with pride and confusion and something like dread. Menon looks like he is watching his understanding of the world crack. Emma feels the weight of all of it, and under that weight, something older stirs. Not courage, not heroism. Responsibility. The kind that does not ask permission. Emma's eyes return to Kearns. How long does he have? She asks. Kearns answers without hesitation. 4 hours, he says. Maybe less. Her throat tightens. She keeps her face blank. She turns her head slightly, scanning the lobby again, searching for the exit she used to take when she wanted to disappear. There is no exit now. Not one that does not come with consequences. Emma exhales long and controlled. If I go, she says, I do it my way. Kearns' eyes narrow. Define your way. No interference, Emma says. No committee, no second guessing in the bay. You bring me to the patient. I call the shots. Kearns holds her gaze for a beat, then nods once. Agreed, he says. Emma does not allow relief to show. She does not allow anything to show. She turns toward the hospital corridor, leading back to the emergency department. I need 2 minutes, she says. Kearns' tone sharpens. We do not have 2 minutes. Emma stops and looks back at him. You came into my hospital, she says. You watched what I did today. If you want my hands, you wait for me to secure the people I just took responsibility for. Kearns studies her face, and something like respect flickers quick and contained. 1 minute, he says. Emma walks away. The hallway outside the emergency department smells like sweat and disinfectant and the metallic ghost of blood. The bays are full, but stable. Nurses move with tired efficiency. The charge nurse is at the board, eyes red from concentration. Emma steps up beside her. Flail chest, Emma says. Hourly incentive spirometry. Watch for increasing work of breathing. Keep pain controlled, but do not oversedate. The charge nurse nods rapidly, pen moving. Chest tubes, Emma continues. Repeat chest X-ray in 6 hours. Confirm position. Watch for subcutaneous emphysema. Got it, the charge nurse says, voice tight. Emma turns to Menon, who stands nearby, still sweating, still processing. You did good, Emma says. Menon's eyes flick up startled. I was terrified, he admits. Good, Emma replies. Fear keeps you from being careless. Do not let it keep you from acting. Menon nods like he is storing the words for later. Holloway stands a few feet away, arms crossed, jaw clenched. Emma faces him. The head injury patient, she says. Repeat neurochecks every hour. If pupils change, you call transport again. You do not wait. Holloway's eyes flick toward Kearns' uniform, visible at the far end of the hallway, then back to Emma. You're Navy, he says, voice low, like he cannot decide if it is accusation or revelation. Emma does not answer. Holloway swallows pride, fighting with the reality that his department would have broken without her. He nods once stiff. I'll handle it, he says. Emma turns to Marcy, who stands near the medication room, hands clasped tight. Marcy meets her eyes, and for a second, Emma sees the kind of care she has been dodging for months. "Thank you," Emma says quietly. Marcy's face crumples, and she blinks hard. "Go," Marcy replies, voice thick. "Go save him." Emma turns away before her throat can close. She walks back down the corridor toward the lobby. Kearns, Harlan, and the suited man wait, as if they have not moved at all. Kearns checks his watch. "That was 1 minute," he says. Emma does not respond. She keeps moving. The elevator ride to the roof is silent. Kearns stands at her side, hands behind his back, gaze fixed forward. Harlan stands on her other side, looking at the floor like he is remembering 1,000 decks beneath his feet. The suited man watches the elevator doors hand near his jacket. Emma watches the numbers climb. Her heartbeat matches the mechanical hum of the lift. When the doors open onto the rooftop, the ocean wind hits her face like a slap. It tastes of salt and cold and distance. The sky is bruised with late evening light. A Black Hawk crouches on the pad rotors, turning crew moving with practiced urgency. Kearns steps out first. The crew chief salutes. Kearns returns it without breaking stride. Emma steps out and pauses at the edge of the pad. The rotor wash tugs at her scrubs. The noise fills her bones. Below, through the rooftop barrier, she can see the hospital windows glowing. People stand behind the glass, faces turned upward, watching. Holloway is there near the stairwell door with Menon and Marcy, and 2 residents, all of them drawn up to witness something they do not understand. Holloway's eyes are fixed on Emma like he is looking at a person he misjudged and cannot admit it. Emma climbs into the helicopter without looking back. Inside the cabin vibrates with engine roar. The air smells like oil and metal and rubber. A crew member hands her a headset. She puts it on with movements that do not hesitate, as if her hands remember the ritual, even if her mind resists it. The helicopter lifts and Wilmington falls away beneath them. The hospital becomes a block of light near dark water. Emma stares out the window until the land thins and the Atlantic opens black and endless. Kearns leans forward, voice raised through the headset. "I read your file," he says. "Not the sanitized version. The real one." Emma keeps her gaze on the dark water. "I do not care," she replies. Kearns's tone stays steady. "You were 3 decks below a propulsion space fire," he says. "No evacuation route. Heat beyond safe operating conditions. A surgical team of 4. 2 of them lost consciousness from heat exhaustion." Emma's jaw tightens. "What is your point?" she asks. "My point is that what you did should not have been possible," Kearns replies. "Command estimated 70% casualties. You kept it under 10. Emma's voice turns sharp. "I kept it at 6 deaths," she says. "That is not under 10. That is 6. The words scrape her throat as they leave. She tastes them like blood. Kearns watches her, then shifts tactics. "Tell me their names," he says. Emma's hands tighten around the strap across her lap. For a moment, she considers refusing. Silence is a shield. Names cut through shields. Then she hears again the hiss of air escaping a chest, the sound of a body being pulled back from the edge, and she knows silence is not what Kearns came for. She speaks without looking at him. "Eli Parker," she says, "corpseman. Smoke inhalation with airway burns." His mask melted against his face. Kearns does not interrupt. "Catherine Sloan," Emma continues. "Deck crew. Tension pneumothorax complicated by cardiac tamponade. I got a chest tube in. I did not have time to crack her chest. Not with the others coming in." Her voice is flat, clinical. It is the only way she can hold it. "Devin Miles," she says. "Shrapnel, perforated bowel, mesenteric injury. I resected what I could. He went septic in the heat." She swallows once. "Riley Chen," she says. "Traumatic brain injury. Pupils fixed by the time they carried him to me." Her fingers tighten on the strap. "Marco Reyes," she says, the last name catching in her throat, even though it is not hers. "Multiple shrapnel wounds. Exsanguination. We ran out of blood." She pauses for a breath that feels too small. "And Samir Khan," she says, "electrical burns, inhalation, chemical exposure. I intubated. His lungs failed anyway." Silence fills the headset for a moment. Only rotor noise remains steady and relentless. Harlan's voice cuts in quieter. "You remember every detail he says. Emma finally looks up, eyes hard. I remember what they were wearing, she replies. I remember what they said. I remember the exact time each one stopped moving under my hands. Kearns leans back slightly, studying her face. That is why you ran, he says. Emma's mouth tightens. I did not run, she says. Kearns does not argue the word. He reaches into his own folder and pulls out a phone. He taps the screen, then holds it toward her. These came in after the investigation closed, he says. You were never given them. Emma stares at the phone, resisting, then takes it because her hands move before her pride can stop them. An email fills the screen. She scrolls. A mother thanking her for staying with a son so he did not die alone. A husband thanking her for giving a wife every chance under impossible conditions. A sister thanking her for speaking a sailor's name when everyone else was too busy counting casualties. Emma's throat tightens. Her fingers tremble slightly against the glass. Kearns's voice comes through the headset softer, only because the truth has weight. They do not blame you, he says. They never did. Emma's eyes blur. She blinks hard, angry at her body. I blame me, she replies. I know, Kearns says. Emma hands the phone back quickly as if it burns. The helicopter begins its descent. Through the window, lights appear on the black water like a city floating. The carrier's outline emerges massive and unreal, a slab of steel lit by deck lamps and guarded by darkness. The helicopter lands with a jolt. The side door opens and humid air rushes in, carrying jet fuel salt and something faintly acrid that makes Emma's stomach turn. Smoke. Not thick, not choking, just enough to wake her body's memory. A young officer waits at attention on the flight deck. He salutes Kearns, then looks at Emma with open relief. Admiral, he says. Ma'am, this way. Emma follows through watertight doors and narrow corridors painted gray. The ship hums with machinery. The floor has a subtle vibration like a heartbeat. Her feet adjust without thinking. Her body remembers how to walk here, how to turn corners without scraping shoulders, how to move with purpose in confined spaces. She hates that it feels familiar. They reach the medical bay. Heat hits her before the door fully opens. It rolls out like breath from an oven. Sweat breaks across her skin instantly. Inside faces shine with moisture. Masks cling to mouths. A corpsman wipes his forehead with the back of a gloved wrist, leaving a smear of sweat and disinfectant. A surgeon meets them at the entrance, eyes, strained uniform, damp hands stained faintly with iodine. Lieutenant Commander Jonah Grant. He is younger than Emma, early 30s, competent and exhausted. The kind of doctor who can handle routine trauma, but knows when the room has become something else. Thank God, Grant says, voice tight. He is deteriorating. Pressure just dropped again. Emma steps past him without ceremony. Show me, she says. They move to the table where Alex Mercer lies unconscious. His skin is pale. His lips are dry. A monitor flashes numbers that are too high and too low in all the wrong places. Blood pressure, 80/40. Heart rate 130. Oxygen holding for now. Emma's hand presses into his abdomen. The belly is tense, distended, guarding its secrets. She looks at the ultrasound image already clipped to a board. Free fluid in all quadrants. Splenic rupture, Grant says. We have been transfusing, but it is not enough. We cannot keep up. Emma's gaze snaps to Grant. Because the spleen is still bleeding, she replies. We take it out now. Grant swallows. I have never done a splenectomy under these conditions, he admits. Emma meets his eyes. I have, she says. You assist. Do exactly what I say when I say it. Grant nods quickly, relief and fear mixing in his expression. Emma turns to the tech. Laparotomy tray, she says. 4 units, O negative ready. 2 suctions. Extra lap pads. Hemostatic agents. The tech hesitates. We have limited agents, he says. And suction 1 keeps overheating. Emma's eyes cut to the suction machine, then back. Then we work like we do not have suction, she replies. And we do not waste a single pad. Her voice does not rise. It does not need to. The room aligns around it. Emma moves to the sink and scrubs. Hot water adds to the heat, turning the air thick. Sweat beads on her forehead and runs down her temples. The mask clings to her mouth. She keeps scrubbing methodical, the ritual grounding her. For a moment, her eyes close. A hand in hers limp, a pulse fading. She opens her eyes and looks at the faucet as if daring it to shake her. The tech helps her into a gown. It will be soaked within minutes. The surgical lights shimmer slightly in the heat. Emma steps to the table and holds out her hand. Scalpel, she says. The instrument settles into her palm with familiar weight. She pauses for one controlled breath, then makes the incision. Midline laparotomy. Clean. Decisive. Blood wells immediately dark and urgent. The suction whines, then sputters. "Come on," a corpsman mutters, slapping the side of the machine. Emma does not flinch. "Manual suction," she says, "and pads." Grant hands her lap pads. Emma packs the abdomen quickly, controlling the field in seconds. "Retractor," she says. The tech places it. The cavity opens and heat rises out of the body like another kind of smoke. Emma's hands move through blood and tissue with practiced certainty. She is not guessing. She is feeling for the source-reading anatomy like a map she memorized under worse circumstances. "There," she says. The spleen is enlarged, ruptured, bleeding actively. A dark tear across fragile tissue. "I have the splenic artery," Emma says. Clamp, Grant replies, already moving. Emma isolates the vessel and clamps it. Bleeding slows, but not enough. Capsular tears continue to seep. "We take the whole thing," Emma says. Grant's eyes flick to the monitor, to the dropping pressure. "How much time?" he asks. Emma does not answer with a number. She answers with action. "Suction," she says. "Pads. Hold exposure. Do not chase blood with panic." The suction machine coughs again, then dies with a small click. The tech swears under his breath. Emma's head turns slightly. "Do not waste breath," she says. "Use your hands." The tech grabs a bulb syringe. Another corpsman grabs tubing and begins manual suction. It is slower. It is messy. It is enough. Emma works the short gastric vessels, tying and cutting, tie and cut, every motion economical. Sweat runs down her face. She blinks it away. Her mask is soaked. Her hands remain steady. A corpsman near the foot of the table sways. His eyes flutter. "Sit," Emma says without looking up. "I'm fine," he insists, voice thin. Emma's gaze snaps to him sharp. "You are not fine," she says. "Sit down, or you will hit the deck and become another problem." The corpsman sinks onto a stool, breathing hard. Grant watches her hands, watching the speed, the precision. His fear shifts, not gone, but redirected into focus. "Ligate here," Emma says. "Yes. Hold that. Good. Now give me the tie." Grant hands her suture. Emma ties with fingers that do not hesitate, even as sweat drips off her wrist and into the drape. The spleen begins to free. "Lift," Emma says. Grant lifts gently. Emma finishes the last attachments, then removes the organ, dark and ruined, and hands it off. "Irrigate," she says. "I want to see everything." Warm saline floods the abdomen. Emma inspects methodically, scanning liver, stomach, diaphragm, intestines. A small bleeder on the gastric wall reveals itself under the wash. "Bovie," she says. The electrocautery hisses. The vessel seals. Emma continues her inspection, slow enough to be thorough, fast enough to matter. "Field is dry," she says. "Close." Grant exhales, not realizing he held his breath. They close in layers. Peritoneum, fascia, subcutaneous, skin. The monitor numbers climb as the last sutures go in. Blood pressure, 90/60, 100/65. Emma steps back. She strips her gloves off, hands stained red, then washes them at the sink. Water runs crimson, then pink, then clear. Grant stares at her like he has witnessed something he did not believe existed. He begins searching for words. "I have never seen anyone work that fast." Emma dries her hands. "Speed matters when someone is bleeding out," she says. Kearns enters the bay, sweat visible at his hairline despite his uniform. He looks at the monitor, then at Emma. "He will live," Emma says. "If infection does not take him. He is immunocompromised now. Prophylactic antibiotics. Monitor for bleeding. Keep him sedated until he stabilizes." Kearns nods once. "Good," he says, and the single word carries the weight of a warship. Emma looks at Alex Mercer, chest rising steadily under the ventilator, face, still pale, but no longer slipping away. For a moment, the tension in her shoulders loosens just a fraction. The relief is not soft. It is sharp, almost painful, like a muscle unclenching after years. She swallows and forces her face back into control. Harlan appears at the bay entrance, his expression unreadable. "The helicopter is ready when you are," he says to Kearns. Then to Emma, quieter. "We can have you back on shore tonight." Emma does not answer. She stares at the patient, at the steady line on the monitor, at the proof that the past did not win this time. Kearns steps closer, lowering his voice. "You did your job," he says. Emma turns her head slightly. "I did what was necessary," she replies. The heat presses down. The air tastes faintly of smoke. The ship hums around them, alive and moving through dark water. Emma stands in the middle of it, hands clean, now heart still pounding, and she realizes her body stopped fighting the environment without asking permission from her mind. She exhales once slow. Then she steps out of the medical bay and into the corridor where the air is marginally cooler and the steel beneath her feet feels steady enough to hold her. The corridor outside the medical bay is cooler, but Emma can still feel the heat clinging to her skin like a second layer. She walks with Harlan and Kearns toward the ladder well, past sailors who glance up and then look away, polite, exhausted, moving with purpose. The ship vibrates under her feet, a living machine cutting through dark water. Somewhere above, a jet launches, and the sound rolls through the steel like thunder trapped inside a drum. At the hangar bay access, Kearns stops. He turns as if the corridor itself is a briefing room. "You are coming back with us," he says. Emma meets his eyes. "I came here," she replies. "That is not the same thing." Kearns holds his posture, hands clasped behind his back. His face is still carved into command, but his voice drops a fraction. "Then tell me what it is," he says. Emma's throat feels raw, not from talking, but from everything she has held down. She keeps her voice steady anyway. "I will return to duty," she says. "On my terms." Harlan's eyebrows lift slightly, like he is surprised she is negotiating instead of surrendering. Kearns does not flinch. "Define your terms," he says. Emma looks down the passageway toward the medical bay door where light spills out and bodies move behind a windowed panel. Alex Mercer is in there breathing alive because she refused to freeze. "I want a billet that makes this transferable," she says. Austere trauma, heat, smoke, power failure, limited blood, no backup. "I want to train Navy doctors to function when everything around them fails." Kearns studies her for a long beat. The ship hums. A distant alarm chirps and then stops. The corridor smells faintly of jet fuel and disinfectant. "You want to be an instructor," he says. "I want no one learning this alone," Emma replies. Harlan shifts his weight, watching Kearns like he knows exactly how hard it is for a flag officer to agree to something he did not order first. Kearns nods once. "We can build it," he says. "Naval Medical Center. You will design the curriculum." Emma does not relax. She is not finished. "And 6 scholarships," she says. Kearns' eyes narrow. "For medical school," Emma continues, voice tightening. "Full ride. 1 for each of the 6 I lost. In their names." Harlan's gaze drops to the deck for a moment. The corridor feels smaller. Kearns breathes out through his nose, controlled. "Done," he says. Emma holds his eyes, making sure the word is real. Kearns turns his head slightly toward Harlan. "Make it happen," he says. Harlan nods, no smile, but something like relief softens the tension in his jaw. The flight deck wind hits Emma again when they step outside. The Black Hawk squats under floodlights, rotors turning. Sailors guide them with lit wands, orange arcs, cutting through the night. Before she boards, Emma turns back toward the island of the carrier. She does not look for the past. She looks for the present, for the proof that one man is still alive behind that steel. Harlan pauses beside her. "You did good," he says quietly. Emma keeps her gaze forward. "I did what was necessary," she replies. "That is the same thing," Harlan says. The helicopter lifts and the carrier shrinks beneath them, a floating city of lights surrounded by darkness. Emma watches until the horizon swallows it. By the time the helicopter drops toward the coast, the sky has turned the color of wet slate. Wilmington glows in scattered pockets, the hospital a bright rectangle near black water. When the skids touch the rooftop pad, Emma steps out into sharp wind and cleaner air. And for the first time tonight, her lungs feel like they belong to her again. Inside Cape Haven, the emergency department looks exhausted but intact. The bays are full of patients sleeping under thin blankets, monitors humming with steady numbers. Nurses move quietly like they are trying not to wake the building. Holloway stands near the charge nurse station, arms at his sides, watching Emma enter as if he is not sure whether she is real. Menon is beside him, face drawn but attentive. Marcy stands a step behind, eyes fixed on Emma with a kind of stubborn hope. Emma walks up to the board and reads it in silence. Then she picks up a marker and writes in clean block letters, "Keller Protocol." Under it, she writes simple steps, not a lecture, not a speech. Just what matters. What to check first. What kills fastest. What cannot wait for permission. Holloway swallows. "Are you leaving?" he asks, voice low. Emma caps the marker. "I am reporting," she says. There is a difference. Holloway nods once stiff, like he wants to say something else, but cannot find language that does not sound like pride. Menon speaks instead. "Thank you," he says. Emma looks at him. "You moved when you were told," she replies. "Remember that feeling. Hold on to it." Marcy steps forward and her voice cracks. "You came back," she says. Emma meets her eyes. "I finished what I started," she answers. Weeks pass in the way they always do, one shift folding into the next, but the department does not reset to what it was. A brass plaque appears near the entrance, polished enough to catch the overhead light. Keller Protocol Mass Casualty Response. Holloway teaches at a whiteboard now, his voice quieter, his confidence less performative. He points to a chest diagram and pauses as if remembering a hiss of trapped air. "Always assess for tension pneumothorax," he tells a group of residents. "Especially when you think it is something else. In a different city, in a brighter building." Emma stands at the front of a lecture hall in khakis, ribbons on her chest, a room full of young Navy medical officers watching her like they want to borrow her nerve. She sets a black titanium pen on the podium. It makes a small, solid sound, like a tool being placed where it belongs. "You will not get perfect conditions," she says, voice calm. "You will get the real ones." She looks out at their faces, some eager, some terrified, all of them listening. Then she begins.